they join. All right, welcome again. Welcome to today's meeting. Today we are going to be discussing clinical documentation improvement practice in the US. This is a remote job gig, man. It is a remote job gig that you cannot do without in the US. This is one of the one of the things that people don't know a lot about, and the vendor of good news is bringing it to you live and direct from the state of Virginia. So you guys should just stay tuned. We have a very well-known, reputable person in our midst today who is going to be dissecting all that you need to know about clinical documentation improvement practice, how it has changed her life. She's a registered nurse, an immigrant nurse. She came to the US. She was working bedside before. Right now, she's working as working remotely as a clinical documentation improvement practitioner. So, guys, just stay tuned, guys. Stay tuned. You're going to be thrilled by the information you're going to be getting today. I know everybody wants to come to the US, but one thing I keep saying is that when you get here, at some point, you'll be like, yes, I've been to the US, I've come to the US, I'm working in the US, but I'm not fulfilled. What else is there for me in the US? And when you start asking these questions, it means that you need more. You need something that can work with your family. You need something that can work with you can work with your family, your kids, or your plans, your career. There's a lot that comes into play. And when that happens, the only thing that can save you if you have a flexible job, a job that can help you to kind of, be able to still do your nursing job, earn as much as you're earning, and at the same time be able to take care of your family and also take care of your husband. Men will like being taken care of. So, every other thing that you have in the US, you take care of them. You have businesses, you're able to take care of business. This clinical documentation improvement practice is one of the gigs that you need to learn about. And today you're going to be knowing it from not the teachers that we always bring here. You're going to be learning about it from someone who went through the program and has started, rocking her job, has started working in the clinical documentation area. So you guys are welcome. Before the new guys, the people that just joined us, before you joined, we were actually trying to know where everybody is joining us from. And then we have people from Brazil, we have people from Ghana, we have people from USA, we have people from Nigeria, we have people from all over the place. Please, if you can, go to the comment section and let us know where you're joining us from. We always do this so we can know, the reach that we have, and also know how we can, give our references and whatever advice we give on this show. We want to make sure that it's covering everywhere, all the locations that we can think of. We want to know where everybody who comes to this show is joining from. All right. So today we have the pleasure of meeting Miss Marianne Somto Opara. Marianne, you're welcome to this show. How are you doing today? You can unmute. How are you doing?
I'm good, Boss Decency. Good evening, good afternoon, everybody, from wherever you're watching us from. My name is Mary Ann Somto, and I'm a registered nurse here in the United States.
Yes, thank you so much for joining, Mary Ann. Mary Ann is not just a registered nurse, she has done quite a great job for herself. She has done a lot. She was an immigrant nurse. She came into the United States, just like every other person did. And then she decided to, go into clinical documentation practice after working bedside for some time. All right, so she has been a dedicated, compassionate registered nurse with strong foundation in clinical practice. So she graduated from, I think it was in Ebonyi State, right? There's a school of nursing in Ebonyi State. It always goes with name Mata, right? Is it Mata?
Mater Misericordia College of
Yeah,
Nursing.
I cannot call all of them. It's difficult for me, honestly. I wanted to end there. But she arrived in the US, and briefly after arriving in the US, she worked med surg, and afterwards she began her journey in CDI. We are going to be learning everything that she knows about CDI. And she's also doing a course that I did, so I don't know, she's following my footsteps. She's doing MBA in healthcare management currently. which is a job that, it aligns, is a career that aligns with clinical documentation improvement practice. I'm just telling you guys, in case you come here and you do CDI, next thing to do is you do a master's in healthcare management, because that will put you in leadership position in the hospital. Anywhere you go, it's going to distinguish you. They are looking for those people that have MBA, HM is like a highly sought after profession. So that is just on the side. So let's get to know you a little bit, non Somto. So just tell us about yourself. What actually drove you into going into CDI? What drove you into pursuing a career in CDI?
Okay, thank you, Buzz, for that question. I've been a nurse for almost a decade now, and I've done a lot of things. I've been in the med surge, I've been in outpatient, I've done endoscopy, and so many things. And I got to a point that I was like, okay, now I don't think I'm happy. I don't think I'm fulfilled. I don't think I am where I want to be. I don't see progression. I don't see, the way out from where I am, where I was. I felt like I was in a cocoon, like I was in a shell. I needed to explore. And also having a young family, I have two under fives. It was taking a toll on me and my family, my job. So I needed to find a way out. I needed to see what's out there for me. What else can I do? What else? Where else can I use my skill in nursing, but not patient facing or front facing? So I was just exploring. I came in contact with departments like utilization review. I also saw the CDI, and I saw other specialties. But on my research, I found out that I closely align with CDI. CDI is Clinical Documentation Improvements Practitioner, CDIP. It is also known as Clinical Documentation Integrity Practitioner or Clinical Documentation Specialist. It's still the same thing. It's just different names, or it's the same person. So when after exploring my options, I narrowed it down to CDI, and thanks goodness, I reached out to Boss Decency. He was offering training on this course, so it was a plus plus for me. And I went through the training, and then I got a job. So I transitioned from my bedside role, where I was working as a bedside nurse, to my CDI job as a CDI specialist nurse. I'm going to go in details and give a deep dive into what CDI is, who is a CDI, what do you need to be a CDI, why do I like it in CDI, and what is the way forward from CDI.
Yes,
So CDI is a nurse. Most times it's nurses, but we have medical doctors here. We have other healthcare practitioners in CDI. But a CDI nurse, an RN CDI nurse, is a nurse that applies their clinical knowledge to evaluate a patient and providers documentation, lab results, diagnostic information, and treatment plans. And we translate this into a coded data. Okay, this may sound ambiguous, but what I'm trying to say is we bridge the gap between clinical and insurance. We are at the middle. We look at the patient's documentation from the clinical side. Is it correct? Is it accurate? Is it specified? Does it give all the information that we need to have? And are we sure that when we send out this bill from the patient document, it wouldn't be denied? For my people in Nigeria, I'm a Nigerian, so I'll come down so we can understand how these things play out. In America, the healthcare here is different. Most people go through healthcare with insurance. So insurance pays for their healthcare depending on what was documented on their medical record. So And insurance are always looking for a small, tiny loophole to say, hey, we're not going to pay for this. Hey, this is not correct, or something is not, aligning. So we want to come in, look at this chart, make sure that insurance wouldn't have any reason to deny paying for the services that was rendered. So that is where I am. I am between clinical and insurance or payers. Um, yeah. So now after looking at the records, everything, if everything is clear, I have to make sure that the record is very clear. There's no ambiguity. There's no attending or medical this doctor saying this patient has pneumonia and somebody else there is saying patient doesn't have pneumonia. So we just cannot send these documents like that to the insurance. I come in, I do the homekeeping. I say, okay, hey, Dr. A, you wrote that the patient has pneumonia, but and I have diagnostic evidence to show that this patient actually has pneumonia. But then this doctor said there is no pneumonia. So tell us what it is. Is it pneumonia ruled in or ruled out? So they will say, okay, it is ruled in or it is not, it's ruled out. They were making ambiguity. There's no ambiguous words. There is no, conflicting information. So I have to make sure the information is complete. I have to make sure it is concise, and I have to make sure it is clear. My job has a lot to do with reading a patient chart. I go through my day reading and reading and reading and reading. So I go through patient chart, make sure that there is no loophole anywhere that insurance will say, okay, no, we're not paying for this, or this is not correct, or yeah.
Wow.
Apart from payers, I also have to make sure that the quality of the hospital is maintained. So I'm also going through these charts to make sure that the documentation actually shows the severity of the illness of this patient. Patient can be, can come in with, let's say, infection, and someone just writes infection. It is not specified. There's nothing like infection. I have to come in, okay, what kind of infection? Where is the infection? Where is the location of the infection? Specify it. This helps us create a good picture of how sick this patient is and what we need to be able to treat this patient. If you just say infection, infection can be just pneumonia, infection can be, cellulitis, and they have different needs for treatment. So we need to specify how sick this patient is, and this helps us to determine what level of care we need to give to this patient and what they need to be able to get better.
So let me
And
just chime in a little bit. So your job is more like an audit, right? You audit patient record, and
yeah,
as you're auditing it, you have a critic mind. You're looking at incomplete documentations and maybe services that were rendered that were not kind of how will I put it, that was not recorded,
captured. Mhm.
documented, or captured. You look for those things, and then you make sure that those things are put in the chart, and then before you send it off for billing, right? Is
Yeah,
that is
yes,
that what I'm understanding?
yes. That is my job in a nutshell. Yes.
So now let me just ask you, like in a day when you get up now in the morning, you don't have to go to like go to what is it called? Go and drive to work or something. There's no need for you to go to the hospital facility at all. So you stay
No.
home and do everything that you do.
Yes, my job is fully remote, meaning I just work from the comfort of my home. Sometimes I work from my bed. I just wake up, just on my computer as early as 5 a.m. and I'm working. Get
Come
my
on,
8 hours.
guys. There's nothing as sweet as this, man. There is nothing as sweet as, your flexibility, your time. I'm not discouraging you guys. There's always a time when you have to start something. There's always a time that you start. But if you have something in mind, a bigger picture, just always think about the bigger picture. The bigger picture is you're not going to be 70 something. I read a statistics about how many years that nurses retire in the US. Do you know? I don't know. On the chat, tell me how many years you want to retire. How old do you think you will be when you will say, I can't do this no more. I love nursing profession, but I'm not going to keep on working. On the chat, I want you to tell me how old do you think you will get to and you will retire from nursing job. I want to do a sample now. I want everybody to type. If you are on this place, if you're on this show, on this comment section, I want to read your comments. How old do you think you would be before you retire? Can anybody tell me how old they will be? Okay, Choma said 60 years. Well, that's fair enough. 60 years, Agatha. 70, 65, 55, 65, 50 plus. So everybody, no, I want more. I want to see more. How old do you want to be at the time that you would leave nursing job? You love it so much, right? But tell me how old? How old? Joe Bonner said 60 years. Choma said 50. Yes, I can see where you guys are all coming from. Another question I could have asked you, how many years do you think you want to put into bedside? How many years do you think you want to put into bedside more? Because that will help us to capture how long you want to be on bedside. Bedside is sweet. I love bedside. I love the fact that you're able to make patient get well, from whatever sickness and whatever that is happening to them. But if your hospital goes bankrupt because insurance couldn't pay them, everybody is going to lose their job. So it's just like a teamwork. Everybody works as a team. The hand cannot say, I don't need the leg. The leg cannot say, I don't need the hand. Everybody works together. So somebody is saying he's gonna stay 1 year in bedside, 10 years after arrival to the US. I want to hear how many years do you want to be on the bedside before you retire, before you say, okay, I'm done. Okay, I don't want to do this no more. All right. So 55 bedside, 55 years in bedside. How old are you? Are you 10? Are you 10 years old? This program is not for kids. Okay, somebody said 7, somebody said 5. So I'm trying to picture if the population of people we have here is the right population, because if this is actually what you're saying aligns with, because I did the research. If you go on, I think americannurse.com, you find out the retirement age, average retirement age of United States registered nurses between 68 years to 75 years. That's when American registered nurses retire. People who are born here, who work here, they live all their life here. They work until they are just like they are bending. You people have seen videos and pictures of people, they celebrate that they work until they are 90 years. They are working like this in the hospital. They say, oh, this woman, she still does her job, she still does everything. No, no, that's not life. Honestly, if you really want a good path for your family, because sometimes when you keep on that path, something will be missing back in your home. You understand? If you keep, focused on, I want to work, I want to work, I want to work. Mind you, you have a family, and before you know it, something will start missing. Some kids will go to school, and that's where they learn everything about sex education. Everything they know about life comes from school, and somebody in school will be busy indoctrinating them in something that you wouldn't like. So for me, I think at this young age, I believe everybody who is here is young or maybe middle age or close to adult, close to senior. Everyone that is here, I believe it's time for us to reason and think the future. If you're thinking future, CDI is the best place for you to be. All right, so now I've gotten all that you guys have said. Okay, so we're going to go to the next question for Somto. So I know in a day, when you wake up in the morning, you said you just get your computer. Can you take us through like a day-to-day activity, like from morning till the end of your day? Like, what do you do? Like, is it when you log into your computer, you're being given an assignment, you're given 10 patient charts to review? Is that how it works? Or you have a particular way that the job is structured? Can you give us a little bit of the job description of CDI? Like, how do they do it? Is it just to read and review patient chart? Is there another thing that they ask you to do? And this job, does it come with benefit? This is the second question. Does it come with all the benefit like health insurance, dental, vision, tuition reimbursement, all the things that people get when they get a job? Or is this just a PRN job that doesn't have anything, to it?
Okay. Thank you. So my day starts as early as 5 a.m. I log in, clock in. First thing I do is to check my emails because there are so many emails coming in. Now we don't have face-to-face interaction with colleagues and team members, so a lot of emails are flying in and out. So I check my emails, and then the next thing is I open up the electronic health record, and then I open up the CDI software. So I there is like a pile, or there's like a list of patients that needs to be reviewed, and it's based on priority and how sick this patient is and how more things you need to do. So I go through each chart based on the priority. As I'm reviewing the charts, I'm coding it. I'm documenting the codes, and if there is any diagnosis that was not captured, let's say there was patient had hypokalemia, like had a low potassium, and provider gave PO potassium. They treated potassium, but they didn't document hypokalemia. So I'm going to document, hey, doctor, on so and so day, there was this potassium of this, there was treatment with this. Can you clarify the diagnosis that matches with this clinical finding? So I'm sending queries. That's what we call queries. Queries are also it's clinical documentation clarification request. So let me not call it query, because query to a Nigerian sounds like, okay, you are in trouble.
Punishment.
Yeah,
You're
but that's not
punishing
what I
medical
mean.
doctors. But finally,
Yeah.
like me, like when I used to work in the OR, and we used to have, like, when you do a surgery and then you put all your supplies, like everything that you use, like abdomop and everything. If there are some that you missed out, I think it's a CDI person on the other end will query us. They will send us a query and say, can you go back to your chart and add this? So we used to frown at it. It's not always it's not always, when we see those messages, we'll be like, these people have come again. Why can't you just leave it? It's just $50 worth of abdomen. What is there? So we used to do that. I know people always frown when they get some queries like that. Some people call it the naughty list. Naughty list is people who do not do their chart very well. So you say, okay, you go to the naughty board and get your naughty list, and then you can go and fix your chart, that kind of thing. So I believe that's similar to what you're
Yes,
saying, right? So
yes,
somehow
yes,
it's
yes.
punishment. Somehow
Oh
it's
no, no, we're not witch hunting. We're not punishing anything. We just
okay.
want
I got you.
everything to be spelled out like straight. This is what it is. We
Right,
don't want,
right.
because when you go through denials, I've seen denials. You see that somebody that came in for this, insurance will always look for a tiny reason why they don't want to pay for that. So imagine a patient staying in hospital for 5, 6, 7 days, and insurance is not paying you. So all the services, all the medications, all the everything is just gone. So we try to, really make sure that everything is, correct. So we're not witch hunting anybody. We're not trying to be wicked. No. So that's part of my job. And also I do physicians education. I teach them, okay, doctor, I know you're very busy, but we need you to document this way so we can be able to send this to insurance. If I send it the way you write it here, they're going to flip it from the window. They don't want to look at it. So I'm doing teaching physicians education. I'm sending queries. I'm looking at the chart. It's a lot that I do in a day. But you know what? It's not as crazy as it is at the bedside. I love it. I love CDI, but I'll come to it. It is self-paced. Just your job done, get your numbers in, get your 8 hours, and you clock out.
So how
So
many charts do you review in a day?
in a day, I review at least 20 charts in a day. So I look at the health and physicals. That's where I start off from, and then the ED notes, and then the diagnostic test, and then the progress notes, and then the consult notes. So with this, you've looked at everything. It sounds very big, but sometimes it's not that big. It's not
Right.
that a lot to look out for. Um, but it can be. very difficult, very big for ICU patients. It may take you a long
Yeah.
time to go through. But if
Yeah.
it's like a normal patient, it can take about 10, 15, 20 minutes to go through.
Wow.
So it's not as as big as it looks. It's not as difficult
Right.
as it is, honestly. So
I
yeah,
almost
and
said
then
I will be choosing patients that end their journey in the ED. Like all those people
no.
that come and they just, "Oh, okay, go back, you're good. We're not admitting you."
I wish you have that option, but no, we have to choose according to priority.
Okay.
Yeah, so and it's a full-time job, for us, for me in particular. I transitioned from my bedside role to this job in the same hospital. So I didn't like leave my hospital. I was started on my base salary, what I was, earning as a bedside nurse. Yeah, because they had to train me. I'm not really making a lot, but I'm still on my base pay, but I have all my benefits: medical, dental, 401k, vision, tuition reimbursement, you name it. Every other benefit every other person gets, you get it. Just that I'm not going to the hospital, I'm not driving under the snow, I'm not um going to clock in and out and then get punished for clocking 1 minute late, and all that stuff. So you work at your own pace and time.
Wow. Wow. Do you guys have a low census? In Bedside, there are sometimes they'll come and say, we have enough nurses, we have low census, you can go back. Do you have low census in CDI? No low
Uh,
census.
yeah, for my hospital, sometimes like on Fridays, we don't have so many charts to review, so we tend to use it as our continuous education.
Okay.
We go into maybe look at webinars on CDI or do some teachings on CDI. So yeah, even if there's low census, nobody is saying, hey, don't clock in, or you have to get your 40 hour done.
Wow.
And, yeah.
Wow. Let me tell you guys something. Some of you that are still planning to come to the US, there's something called low census. You're planning to make, pack all the money that is in the US. Sometimes you come to work and they tell you there is low census today. You got to go back. And you'll be thinking they are joking. They will flex you off. And you cannot contest it. You have to go back to your home and you will not be paid for that day, especially if you don't have guaranteed hours. If you don't have guaranteed hours, there's no pay for you because any hour you clock in and work, that's the hour you get paid for. You understand? So for low census days, there's nothing that you get paid for. You understand? So I'm so happy with the insight that you have given. I like the fact that we are able to understand a little bit about what CDI is all about. And I hope all of you on this call know that Decency NCLEX Academy, in collaboration with Novell Training Services, has been providing CDI training to all internationally educated nurses that want to go into this route. We are providing those services and we are giving it at a discounted rate for you guys. You don't know what we are doing until you try and look up those services from other vendors. You will notice that we're giving it at a very, very discounted price. All because we want to make sure that people are well situated here in the US when they come in. We don't want you to come in here and begin to ask yourself, oh, would it have been better if I stayed back home? You understand? Because every opportunity we find a way to kind of bring it down, let it trickle down to all those that are listening to us. All right. So I'm asking everyone, if you are interested in this, you can start doing it even from back home. You can take the exam. I have about 7 or so people in EPG who has taken the CDI exam, all right, and they have passed. They are just waiting to come here and then they will transition to CDI. You understand? One of my madam have come. Welcome, ma. How are you doing? Welcome, welcome, welcome. All right, so yeah, so if you want to go into CDI, if this is something that you want to do, I want to implore you, try as much as possible to do the training. If you do the training, get everything squared out. Once you come here, done with your program, done with your agency program, or even when you're still in the hospital doing your program, there's something that Somto said. Somto said she was able to transition from bedside to CDI in the same hospital, which means you can actually ask your hospital, oh, I have done this program and I think I'm very good with it. I did it very well. I'm certified in this area. They can actually transition you to their department, and then you can work from home, make your 40 hours for your agency, and then you're still taking care of because what all that your agency wants to do is to make sure that you're clocking in every morning. Okay, you're getting your 40 hours, they are good. You understand? So if you're able to make sure that you get that crossover in through departments, cross from one department to another in the same hospital, you should be very good with that, and you'll be able to work from home and at the same time do other things that you want to do. Do family, do yourself, do your husband, do everything that is doable around your house. You understand? So I have a question, but before we take that question, I want to welcome Yemi. Yemi is one of the directors of Novel Training Services. Yemi, how are you doing today?
I'm good. Nice to be here.
Yeah, and Yemi, I have Somto on the call.
Yeah,
So,
I see that she's been answering the question wonderfully.
okay, yes, she's been doing justice to it, and we are enjoying her. We're enjoying every bit of all information that she's giving us. We have a question from Stella, so let's see what Stella has for us. Stella, you can unmute and ask your question. Stella, how are you doing today? Where are you calling from?
I'm all right, boss. Good evening. Hello, Somto and Yemi. Are you
Hi,
guys
Stella.
okay? I'm
Yeah.
all right. I'm calling from Newcastle, England, United Kingdom, but
Oh,
I'll
nice.
soon be joining you guys soon. I'm
Welcome.
waiting for my.
Awesome.
Thank you.
Yes.
I'm just current, waiting for my ID.
Okay.
Oh,
Awesome. You will get it.
Amen. So my question is to Boss Decency. First question. The first one, you talk about low census. When you come to work and there is low census, you can be asked to go back.
Mhm.
Does it really apply to only agency nurses, or applicable also to direct hire nurses? If you are part of the hospital, is it a scenario where they can ask you to go back? Then the other question goes to Somto, not Somto, concerning the CDI. You made mention that you're still working in the same hospital where you were recruited initially. So how does it work? Is it like if I start the training from UK before I come in, I will be recruited in the, but like I did interview with telemetry medical units. Should I supposed to work there for some specified number of years before I can tell them I need to migrate to the CDI department, or once I come in, I will show my certificate, or is there any clinical expertise I need to acquire before I go into the CDI department? Thank you very much.
okay. Thank you for that question, Stella. My advice is you come in, do be a while in your unit because you need to know how US works. It's different from every other place. It's different from the UK. It's different from Nigeria. So you need to understand how this whole place works. The patient, how they document, what to look out for, and stuff like that. So you need to get at least used to US system. So I say give it probably a couple of months or at least 1 year. Now, because when they want to take you, even though you have the experience, they want you to have hands-on experience in acute care. So it
Okay.
could be acute care or critical care. And sometimes your international experience doesn't really relate or translate to what they want. So they want you to have UX experience. So our advice, do a couple of months before you start talking about them transitioning you to CDI. But that does not stop you from taking the course now, getting your certificate, because this job is a very, very, very extremely competitive job. You need to be on a very good side to be able to get this job. I describe it as a job for the cream de la cream. Everybody wants to go off bedside. Everybody wants to go remote. So you need to be in a place that you are, the most preferred candidate for this job. So you need to get a CDI. It is not like it's very, very compulsory, but you need it to be able to stand out, to be able to be given a chance. When I did my first interview in my hospital, I didn't get a job because they said they had somebody with 11 years experience. So why would they give me a job, me as a newbie, compared to somebody with 11 years? So when I came back second time to say, hey, I have this certificate, I've been working in this hospital for a while, I have the experience, at least to some extent, I've been liaising with other CDIs, I was able to bring myself forward to say, okay, this is why I am a very competitive candidate for this job. I was able to stand out. That was why I was able to get it, because it is very competitive. So you need to be on a very good side. I'll allow Yemi to add
I
some more.
think
She's my boss in this game.
you've done an excellent job to the question. All right, you said everything, said in the most beautiful way possible. Something I would like to add is that, like Somto said, it's good that you get your certification now. And the reason is that, and also to wait a little bit at your hospital before you transition. But it doesn't stop you from doing CDI. For instance, myself, before I got my first official job in CDI, I had shadowed and get some experience that were not official, but I could claim in my resume as an experience. So if you have your CDIP certification, you come to the United States as they are working on the acute care, floor. You could also dedicate maybe 2 hours a week, 3 hours, depending on how much time you have, to shadow somebody. I don't know where you're going to be. I don't know how easy that is going to be, but it's something that is possible. Possible. Maybe they even have CDI in your hospital. You could shadow them. As you're shadowing them, guess what? You are getting some experience together. And the thing is, I might not even be up to that 1 year, some to say, depending, places, United States is a very flexible country, depending on the hospital you are and where you find yourself. The first thing is that they want you as an acute care. That's the first thing. You tell them something else, they will have issues. So enter first. So the moment you enter, check, make your some findings. Oh, do they have CDI department? Yes, they do. You check, is there a vacancy? Yes or no. If there is no vacancy, okay, you can reach out to them and be like, this is a unit I'm interested in. Can I be coming to shadow you guys 2 or 3 hours a week or something? If they say yes or no, if they say yes, guess what? You are getting your experience. And those 2 hours will not feel, it won't be stressful at all, because CDI is not a stressful job. You're just going to learn a lot more stuff. So that when you are now ready to do that transition, and get and another advantage to shadowing is that the first time they have a vacancy, it's going to be easy for them to want to transition you, that their workflow, to their team, rather than a stranger that they don't know. So it's going to give you an advantage and a edge over outside applicants. So that is why I would say that, yes, even though you're in the UK right now, it is a good idea to get a certification. And the moment you come into the country, even if it is not in your hospital, it could be in an hospital around you, you could give your time. America is a place where they allow people to shadow people. Even you just have to reach out to their HR and be like, can I shadow you guys? They'll be like, yes, it's fine. So far, they can do some checks and confirm that you are legit. Yeah. So, and then that time that you add, that period of time that you have between working on the floor and transitioning, you will be able to claim as an experience in your resume. So when you are ready, you're not going to have issues with doing it and they're like, you don't have experience, you don't have experience, you don't have experience. So yes.
Oh, thank you very much, Yemi and Somto. I really appreciate.
Thank you
One thing
so
to
much.
add quickly is sometimes people don't even know that this department exists in the hospital. Like mine, I asked 1 million people, please, do you have CDI? They don't even know.
They don't even know
So
what it is, right?
they don't know what it is. So it is under Health Information Management Department or Quality Department or Revenue Cycle. So it's either within these three departments. So it depends on the hospital. If you are asking questions, ask the right person, because they will tell you no.
No
They don't know.
No, I remember when I go to the United States, I'm asking people, like I do chat with a lot of my colleagues. I'm like, what specialty would you like to do? What unit do you like? And guess what all of them will say? They'll be like, maybe they'll do clinical research, or maybe they'll do, all of them keep talking about areas outside of bedside. Nobody ever mentioned CDI. The day I attended a webinar, I got into CDI by attending a webinar. So I'm like, what is this thing they're talking about? And when they explained it, I fell in love immediately. And I'm like, how are people not talking about this department as a possible specialty for nurses? Nobody talks about it. Then I realized that the people that have been in it for years, and they kept it quiet, like a secret cult. They don't talk it, they don't give the opportunity to young people to come inside, to come into until we started talking about it. Yeah. So yes.
All right, so see, so that's what I said. One of the things we do here is we open up everything, full disclosure to all of you, so that when you come here, you can make the best choices. And I believe that all that they have said now, Stella, I believe your question was answered. And I believe, we are open enough to tell you this is what and who we are currently. And I believe that, if you come over here, if you want to go into this CDI, you have every opportunity to do so. If you want to start the training now, you can reach out to the email I dropped, admin@noveltrainingservices.com. Just email that and then you get all the details on how to make payments. And the course is for 8 weeks. It's not something big. 8 weeks, you can do it, get the certification, and put it in the bag. A lot of you have been asking me during retrogression, what can we be doing just to wait? Just to, this is one of them. Every day I come here on Fridays, I always drop one thing that you can be doing to wait during retrogression. This is one of them. Get yourself ready. Go and do CDI. The CDI course is actually $1,500. $1,500 is how much? $1,500. But now we are discounting a whole lot for you because of all of you that are here. I've asked the Training Institute to discount it, so it's going to be half the price, $750. If you want to do the training, you can reach out to admin@noveltrainingservices.com and they will do it for you at $750. Also, if you want to get that discount, mention that you were on this program. If you mention that you were on this program, you would get the $750. So I'm giving you a whooping $750 just for being on this show. That is what you're getting for being on this show and opting to go for the training. That program also is more than that amount. Novel Training Services is doing that as just a giveaway, but it's more than that amount. It's more than $1,500. If you check other vendors, they do that program for $3,500, $5,000, because they know this is something. It's just like doing a course. And someone was telling me that people don't really know the advantage of going into CDI by just doing an 8 weeks course and just going and getting the job. That very soon, this whole program can be enlarged and moved into a faculty, and it becomes something you go to the university to read. And if it happens, guess what? We are not all going to have that opportunity that I'm presenting to you. So if you want to do it, now is the best time to just get in the action.
Just one more thing to add to what Mr. Decency says. See, I know that we have young adults in this group as well. I've had a lot of people that will message me, oh, Yemi, I'm having my baby in so weeks. I'd like to come and do this CDI so that I can stay home and take care of my baby. And in my head, I'm like, you've known about this thing for a long time. You're just talking about it now that you have a child coming in, your mom is not able to come. And even if your mom is coming, sometimes when you have a little child, it's difficult for you to want to leave them in a daycare, knowing that they are susceptible to so many infections and all. So it's always better to plan ahead and not wait till that last minute to make that decision to do something. Even if you don't think that you need it now, it's better to do something earlier when people are doing rather than wait till late. And then be like, oh, you want, because there's a lot of process into it. You can't just get it. It's not everybody that gets certificated today like Somto here. I got certificated today and they got job in 2 weeks. She's like, I don't know. She's like our model student. Yeah, some people, it takes them about 4 months, 4 to 6 months. Some people 3 months, some people 1 month. It varies for different people. So it's not like, because it's going to take you like 4 weeks to write the exam, some weeks to get to do interviews. Some interviews will tell you no, and then from the interviews, you're going to learn what questions do they ask. How can I, be better for the next interview? Because sure, you're going to be getting interviews. You might not get that job on time, but interviews will keep coming because there are many jobs out there. And the moment you get the experience, you're going to be the one turning down jobs. That is it. That is the honest truth about CDI. Right now, I don't even apply anymore. Jobs come to my phone, and I tell them no all the time. So I would just encourage us, if if some of us here are young adults who plan to have a family and we think this might be an option, don't wait till that time you are pregnant, because you're going to be putting us under pressure. Just do it ahead of time, so that, because for me, I think I left bedside when I had my babies. I had twin boys, and right now I feel like I have the most beautiful work family life balance. I have time for them. I can't play, I don't get tired. It's just beautiful. So I would just recommend to you that don't wait till the last minute, till when you are pregnant or your baby is due in a few months, or something else is happening in your family that requires more of your time, before you make that decision. Thank you.
Thank you so much, Yemi. So, enough said about that. So, we're going to take questions. I know some people have been dropping questions on the comment section. If you want the mic, if you want to ask us questions, I would give you the mic. If you just use the reaction button and raise your hand up, just signify, and I'll be able to give you the mic to ask your question. I love when people are able to speak to us, so that, people that watch this program later will not think we're just speaking to ourselves. So kindly just raise your hand and we'll give you the mic, and then you'll be able to ask us questions. All right, while that is going on, I'm just going to take one question that says, does the CDI certificate expire? I don't know, Somto, can you answer to that? Does CDI certificate, does it expire? Is it a
Yes,
license or a certificate?
it is a certification and it expires every 2 years, but you renew it. It's not like it expires, it just goes into the oblivion. No, you renew it. It's a continuous thing, and it
Just
doesn't
like
take a lot to
license,
renew.
just like
Yeah,
nursing license, you renew
it
every
doesn't take a
2 years.
lot to renew it. Yeah.
Mhm. All right, then someone else is asking another question. Let me see. It said, if you have MSc in healthcare management, can that help in transition to CDI?
Yes, currently, as this Bosiseti said, I'm currently running my master's in business administration in healthcare management, and this will, give you an edge to go further in your career. If you want to go, a step up about from being just a CDI, you want to go into management. This it will give you that stepping stone you need to climb. So it's a very, very beautiful and a very, very good course to go in. It works very closely with CDI because it takes you into the business side of healthcare. Now you know what to look out for. Now you can manage the hospital, you have the clinical, and then you have the business. So it is a very, very good one to go for.
Yeah, so
Combination.
just to add to what Somto said, it's not going to it's not going to propel you into CDI, but it's being in CDI and having that is going to propel you to a much more bigger role. Does that make sense? Because the CDI experience you have with the certification can prepare you for a director role, or all those intricate big roles that is in the management sector of the hospital.
All right. And then, Yemi, I have a question for you. So you guys do this training, right? So I just want you to throw more light about the program, how it runs, the success rate, our, past performances that we've had. I know we have an evidence here. Before we came with what's her name? I've forgotten her name. Linda. Linda was here before. Linda
Mhm.
is happy with her job. She's smiling and doing everything that day. Everybody saw her energy. She was doing great. And then today we have Somto. Somto is also here, happy on the job. So can you give us an insight into Novel Training Services, what you guys do and how far you have been doing this, everything that we need to know about the
So,
program. Of course.
Nobel Training Services first started as always telling a lot of people about CDI. When I found out about CDI, I couldn't stop talking about it. I wanted the world to hear about it, because I was like, how is something this beautiful not known to many people? So it started with us telling friends and all of that. Oh, come and do this, and then we'll help some people into CDI. And then sometimes when we just give them the materials that we have available, like maybe textbooks and all of them, they go write this exam and they fail. And it's just so difficult to help people to pass the exam, and realize that the materials that were available were theoretical materials that even when people fail, they cannot identify the reason why they failed, because they're like, I read the whole book, how come I failed? And I think the reason is because the textbooks are theoretical based, while the exam are clinical scenarios. They are like more practical. So the person has to be able to bridge that gap. And there is no textbook that kind of bridge the gap between the theory and the practice. So then we now started working with a couple of people, and we would realize that when we discuss with them, we would do a phone call, interview, have them come around, would explain the thing to them and realize we had more success with. That was what brought up the novel training services. So we developed a course that will allow people to understand what is really important. Because a lot of the textbooks out there, probably a third of it is what is necessary. And even that a third that is in there does not reach that cap that you need to pass. You have to be a wonderful test taker to go through that document and go in and then pass at once. You have to be awesome at it. So yeah, so that was how we brought about Novel Training Services, and where we initially, I think we started off as a live class, and then it was pre-recorded. We realized that it's taking, like, you need to probably pay a lot of money for it to continue to be live class. So we thought, okay, we will convert it to digital so people can have access whenever, because we realized that sometimes the group or somebody might just be ready to start today and the next class will not start till like few weeks. So having it come as a digital allows us to be more flexible, and also allows us to give people at a better price. So right now what we have on the platform is 8 weeks access, but we've had people do the course depending on how much time you have in 2 weeks, and they write their exam. But what we recommend is that you take that exam within 4 weeks. If you have 8 weeks access, the reason why we gave 8 weeks access is to allow for flexibility for people that are busy with work, kids, family life, or other things that could happen. I want you to have that time and not say, oh, 4 weeks is too small, I couldn't finish in 4 weeks. So the 8 weeks is just to allow you more time. But we still believe that completing it within 4 weeks gives you a chance of passing on first attempt. Because if you fail the exam the first time, you have to wait 3 months before you write it again. So we also, and the reason why you pass at first attempt with 4 weeks is that you are reading together, right? But if you are spending 8 weeks, you have like 3 days free time, 3 days time that you probably didn't read. Sometimes some people have not even read the material in 1 week. And imagine studying something like a week ago and then coming back studying another thing. The information is not going to be fresh in your head. And then if you go in and write the exam and some of this question comes out, you're not going to give it the best answers that you should give it. And for you to pass the exam, you need at least 70% success. So that is what we basically do. And beyond all the values we put into this course just does not only have information on how to pass the exam. We have how to optimize your LinkedIn for job opportunities, how to do your resume as a licensed professional, or even medical doctors can also do this. Foreign medical doctors, if you have a spouse that is a medical doctor that is coming in, it's a good field for them to come into before they take their residency examinations and all of that. So that is basically what we do. And even after we also have, as part of the course content, interview preparation sessions where we will talk about all the possible questions, at least most, not all, but at least majority of the questions that could come out in an interview. That if you study everything and you go for an interview, they're going to be like, wow, you know so much and you don't even have experience yet. And if you're claiming experience, you'll be able to answer questions as well, probably from shadowing, that would show you the experience that you have. Apart from that, when our students, when they pass the exam, this is not part of the package. It's just something we offer to our students when they pass the exam and they let us know, or when they get the job now and they let us know we got a job with this place. We have another WhatsApp group, it's like a support group where they can come and ask any question. No question is stupid. You can come in things that you probably can't ask your coworker because they're going to think like, oh, how does she not know this? You can come in here, ask your questions, and you have a lot of professionals, experienced professionals that will be there to answer your questions for you with evidences as well.
Hmm. This is power packed, man. This is like total package. Everything that you need from the time that you don't know anything about CDI to the time when you're rocking your job, and any question that you have on CDI, you can go back and ask them. They are not going to just train you and then your money is finished and you can go. They still offer again another service to help you get used to the job, get your foot on the door, get your 2 legs inside the room and do well on the job. That's part of what we're bringing here. So guys, if you are having value for the program that we're having here today, I want you to go to the comment section and type value for me. I want to see at least 50 values so that we make sure that we are doing a great job. Okay, if you know that what you're getting here is valuable to you, please type value on the comment section. If it is valuable, type value. I want to see values. I want to see values. Can we have values on the comment section? Can we have values? Yes, yes. Thank you guys. Thank you, everyone. I think everybody is learning.
I
Everybody
think
is
I'm
gaining
seeing
new
someone's
experience.
question here. Esther is
Yeah.
asking a question. Do you have to do everyday review on a particular patient or when they want to be discharged? So there is a time frame for you to do review. We have two types of review that we do. I'll say three types. We have, let me start with two types. We have what we call concurrent and retrospective. So concurrent review is when the patient is on admission, whereas in the patient is on admission and the other one is when they've been discharged. So mostly at CDI, we do more of concurrent than retrospective review. So some places do retrospective, but not a lot. So mostly while the patient is on admission so that the documentation can be complete before that patient is discharged. So on a daily basis, we will have what we call the initial review and the follow-up review. So for the initial, maybe out of your 20, 10 of them might be your initial review and the other 10 is going to be your follow-up. So the initial review are patients that have never been reviewed by CDI before. And then your follow-up could be patients that you reviewed 1 or 2 days ago. So you don't have to do all of the cases you reviewed before. Like Somto mentioned earlier, all of these things are prioritized. So you can look at your most top 10 prioritized patients, the ones that you scheduled yourself that you like to look at the following day, probably because there are some things you are looking out for in those charts that you would do. So you don't necessarily have to do every review on every patient, but you do have to complete follow-up review on patients on a daily basis, but not on every patient that you saw. And sometimes, and most times, they recommend that, okay, you saw a patient today, you want to do in 2 days. And even sometimes you only have the opportunity to do one review on the patient before they get discharged. So the moment they are discharged, you don't have to worry about it anymore. So it all depends on the workflow of any hospital, of the hospital that you work in, and they're going to let you know the moment you get the job that this is how they do their thing.
Wow. Thank you so much for doing justice to that question. So, guys, I just want to clarify something as well. The discount that we are giving is not forever. It's going to end at the end 30th of this month. So someone texted me and said, can he pay when he comes to the US the same amount? No, it's not like that. This price is for now till the end of this month. If by the end of this month you don't get this discount, then maybe some other time if we invite them, they always give us a little discount when we invite them. They may, but at this point, this is going to be till the end of this month. That's what information I got from them. Okay, that's for just clarity. So does anybody have any question that we can take on this show? Does anyone have any question that we can take? Someone is asking, is CDI the same thing as telemedicine?
No, it
Is
is
it the
not.
same thing? It's not. Okay. So then another person is asking, what's the pay rate for CDI nurse compared to other bedside nurses job? So I don't know. Let's ask Somto, did you take a pay cut when you went into CDI? Oh yeah, you can unmute.
Okay.
Right
So
now, I'll ask you, Somto, do you make more now than when you were working bedside?
Yeah. I think that's
okay,
better.
it can go either ways. When I started off, when I transitioned from bedside to CDI, I was still on my normal pay from the bedside. Because one, I didn't have CDI experience, and because I was still in the same hospital. So I needed to build my experience base, I needed to build my knowledge about CDI. But going forward, you're going to be making money. I'm telling you, you'll be making good money. And you don't need to stress about it. You don't need to drive to anywhere. You don't need to spend money on fuel or so you go to the world and somebody is cursing you and all that. So you'll be making good money in the comfort of your home, in your bed, and at your own time. So it is good money. But you don't have the option of working maybe overtime or holiday pay or other night differential. There's no night shift. It's 8 to 4, 4:30.
And you are salaried.
Monday to
That's why you
Friday.
don't get sent home when there's no census. So your money is guaranteed every week.
Yes,
Every
it's guaranteed. So and then when you build when you build your experience, when you are very experienced in CDI, you go into travel CDI. They are travel CDI. The way they have travel nurses, that people go to hospital to go and work as travel nurses, agency nurses. You could also work as a travel CDI. Go on Indeed. Go on.
Or contract
LinkedIn.
CDI.
Yeah, contract CDI. If you go there, you're going to be making very, very good money. Another thing I forgot to add was you get to a point that you're very comfortable with CDI. You can take on 2 jobs, 3 jobs. People are having 2, 3 jobs at the same time. Imagine that you're using the same time you're using to work for this hospital. Now you're doing 2 jobs with the same time. You're working for here, you're working for here, you're getting money from here and here each week from this job. Do you know what that means? Even if you're working in the hospital, you'll be worn out, your back will be aching, your waist will be breaking, your children will call you like, oh no, I'm tired. Now there's no, you're not going anywhere. You're at home, you're working, you're cooking, you're cleaning, you're doing other things, kind of. So it's flexible. It is not just about the money, but about the flexibility it gives you. It is very, very good.
All right, thank you so much, man. So this job that we are pushing like this, it's not like we want to drag you into something you don't want, you're not gonna like. It's going to be nice when you get into it. Okay, so forget the fact that when you're starting something, it might be a little bit rocky, but definitely there is joy at the end of the tunnel. All right, so there's this CDI is good, is big, is paying very well. The ability to be able to juggle one or two, is all depends on you. It depends on you and depends on policies as well. So I just want to let everybody know there is actually benefit if you take on this step as you are preparing to come to the US. This is something to use. Your retrogression wait time is something to use it for. Build yourself, get yourself ready, and by the grace of God, when you come over here, transitioning to CDI will not be a problem. All right, so thank you so much. There's another questions about what is the resumption date. This is self-paced, so anytime you pay from now till the end of this month, you can start. Okay, and then is the certification exam included in the 750? Queen, you know this thing. You know there is a fee for certification exam. All right, it's not included. Is different. Okay, 750 is for the course. All right. So now, another question we have is, please, I want to know if Decency NCLEX if Decency is sponsor for NCLEX, and also if they have classes. Yes, we do sponsor for. Sorry, we have classes, but we are not sponsoring right now because of retrogression. Whenever we become current, yes, there is always a need for sponsorship. By the way, there's a lot of other agencies. There's agency I'm working on a partnership with very soon, and they are planning on sponsoring a certain number of nurses. So when we get that all finalized, I will come here with them and we'll be able to let everybody know about it. So if you are so indigent that you cannot start your NCLEX process, by the grace of God, we might have something good on the way coming. All right. So, but for now, we don't sponsor for NCLEX. All right. Somebody is asking how much is CDI certification exam. So CDI certification exam is at $329 or $360. Oh yeah, Yemir answered. It's $360, with tax, everything. All right. So if you want to go for the exam, make sure you're prepared. Always go with us. So what Yemi said, everybody that goes through the course that Novell Training Services has mapped out, they always come out successful. You see, this lady we have for you here, Ms. Somto, she did that course within 3 weeks. She did the course that we have for 8 weeks. She did it within 3 weeks, and she was able to write the exam and pass it. All right, so why wouldn't you have 8 weeks and pass the same exam? So I believe you'll be able to pass if you just take that step and do the course and then go for the exam. All right, this exam can be taken in Nigeria. We've had 7 people that have written it in Nigeria. They've bagged it. They are just waiting for them to exit, and they would, use that and start. And also, we have people in the UK that have written the exam as well. So from wherever you are, you can find places where you can write the exam. And those in the US, you can write it from the comfort of your homes. So this is a very good option. I want to let everybody know, if you want to go through it, go and reach out to us on that admin@noveltrainingservices.com, and we'll be able to give you all the information you have. You can also reach out to Decency NCLEX Academy with any questions about CDI, and we'll be able to answer you as well. All right, so now we're going to get our final words from our guest. We have taken so much time today. This is more than 1 hour. So we are going to just get final words from, we'll start with you, Somto. Just to give you a little brief, people that we have here, majority of them have passed their NCLEX. They are just waiting on retrogression. I don't know if you experience retrogression during your own time, but it's a very, very difficult thing. When you don't have NCLEX, they say, if you write NCLEX, don't worry, you would. In fact, mine started with my uncle that was in the US promising me, if you get your international passport, don't worry, take you overseas. And then I got my international passport. And they say, if you do nothing, just the day you're graduating, that's the day you travel. And then I went ahead 3 years, I got nothing. They say, no, if you get experience, get experience. Once you get experience, just 1 year experience in ICU or operating room, you will travel. I went ahead, I got perioperative nursing. They say, no, you see what will happen if you go back again and do your BSN, because now that's where people are now employed. I say, please, wait, hold it there, please. I don't need all those traumas anymore. So I went by myself. I did my own stuff together, did my processes, and came here by through an agency, but I started my process in the initial time. So what am I saying? This is one of the things that if you do it, by the time you get here, you will be in a better place. But also retrogression can be very, 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 I don't know, it can be very frustrating. It can be very frustrating. And I'm just, presenting the population of people that we have here to our guests so that they can give a final word to you guys. It's very, very frustrating waiting during retrogression. But if you wait with purpose, if you wait with something in mind, if you have something that you're working on and you know that this is something that will give you more gain and benefits in future, I guess it will make the waiting go fast, very quickly. All right. So yeah, sorry, Mary Ann Somto Opara, I want to go all the way with your name. So do you have any final word, encouraging word for people like you, came from Nigeria and different countries? You can see we have so many people from different countries today. And by the time we start saying thank you in our different languages, you will see many languages as well. We used to have Gambia, Zambia, Zimbabwe. We have everybody, on this call. So just in a nutshell, what are you telling us to help us, on this retrogression stage or journey that we are?
Okay. Thank you, boss. So my final remarks would be to my people still back in Africa, or even those anywhere you are, and you are trying to find a way down to America. Now you are in the waiting period. The waiting is a time of training. Train yourself. Get something. Be above others. Get yourself in a place that, if there's any opportunity, you'll be the first person to be grabbed. And this includes doing the certification. If you know you are tired of the 12-hour shift, if you know you are struggling with, having family time with your children and meeting up with some other things you need to do, if you know you don't feel, very fulfilled working in the bedside, I'm not saying bedside is bad, no. But some people want more. Some people want to explore other options. So if you know you want to explore other options and you want to really stand out, I will encourage you to try and do this course, because I was there. I've been there. I know what it felt. I was almost getting frustrated, and I had to give me my all to do this course, and it has paid off. So try and do it. Now the discount is on. Try and grab it as soon as you can, because it may not last. When you get this done and you come over and you start working, you understand why I said why I'm encouraging everybody to take on this course. Novel Training Services have every single thing you need to be able to succeed in this course. They will walk you through it. I did mine in 3 weeks because I just wanted to get it done and get out of the training and do something. So you can do it. no matter if you're here or not, you can do it. Get it course, get a certification, prepare yourself, prepare your mind, and when you get here, the sky will be your starting point. And just try. Even if the funds are not there, look, there are options of things you can do to get it done. Thank you.
So much. Thank you, thank you, thank you. I appreciate all the words of encouragement that you have given to our people. And it's just such a good thing that, every Friday we're able to come here and rub minds with, people who were back home before and now they are in the US doing exploits in different spheres of, influence. I just want to appreciate God for the opportunity, that I'm the one connecting A and B together. So now I have Yemi. Yemi is one of the directors of Novel Training Services. So Yemi, like I said, people on with retrogression, they have been there for quite a long time now. None of them don't have, like, some of them, they don't have a time. Some of them are not current. They don't even know when they are going to come out. So but from you to them, what are the encouraging words or final remarks that you can drop for some of our guests, some of our VIPs, those that are on the comment section keeping me busy? What can you tell them so that they can actually be more relaxed and be more productive at this retrogression time?
Yeah. So I understand what it means to be waiting. It's usually like one of a trying time. It feels like a trying time for a lot of us. And some of us would fast and pray and do all of that. But in the process of doing all that, it's important that we also get productive. I have experienced the same. It wasn't retrogression in my case. It was denial of the I-140 back then. I got denied like twice. By the second time, I was like, I am done with this thing. What do I need to do to just distract me away from this thing? And I heard about an opportunity to go to UK. Guess what? I carry everything I have, redirected it, and started my UK processing. And I got to UK within 3 months of trying. Now, if I had just wallowed in the, bitterness of not being denied, which I can tell you is really bad, especially when you know people that are traveling. You wrote your exam really fast, you passed very well, and then they keep denying you. It was Mr. Trump that was there back then, and all of that was happening. The moment I did something that was meaningful, the denial felt like a blessing because I feel like I had the opportunity to experience United Kingdom as a registered nurse. I had the opportunity to meet people, I had the opportunity to not base my life all on US alone. So like I would say, I know some people are already in the UK already. I know some people are still in Nigeria, and I know it's a different thing. But if you give yourself something else that you're doing right now, it will distract you a little bit from the stress of this retrogression, which I know we all check every day. Oh, anytime the bulletin is out, are we current? Are we moving forward? Are we moving backward? What are we going to do? Just find something that will bring you peace. And sometimes when we get busy, it helps with the way that we feel about all of these happenings. I wish you guys all the best, and I pray that things become better very soon. Because I also have friends that are waiting to be current right now, and I know that it can really help and delay a lot of decisions that we have to make about life.
Wow. Thank you so much, Jamie. I felt like crying when you were talking. Thank you, everyone. So, I also want to say something. Somebody else asked me, is it true that medical doctors can do this course as well? Yes. So,
Yeah.
some of your husbands that are medical doctors, this is one of the things that you can give them as a gift. Just pay for this course for them. Let them do this course. As soon as they arrive the US, they start practicing CDI. It's going to be very easy for them. While they are waiting to write their USMLE exam, they can do this course. So I know many nurses are married to medical doctors because in my class then, when I was still a nursing student, it's medical doctors that used to come and collect all the beautiful girls in our class. So I know what's going on. So if you are married to a beautiful girl, no offense. If you're married
I
to a
got that by a
beautiful
medical
woman,
doctor too.
oh, you see, one of those beautiful girls. Okay, guys, so if you are married to a medical doctor, no offense, just get this CDI for the person so that when they come, they can actually have something doing. Because one thing I always want to say, maybe one day we'll talk about it. Many families when they come to the US, money becomes an issue. Money is not always an issue back home, but when you get to the US and the lady starts making more, no offense to the ladies, respectfully, but it kind of changes the family dynamics, and most times the man tends to read meaning into everything. You say there's no money, becomes a problem. Anything you do becomes a problem because you are the one bringing money. All your attitude, everything is now going to be screened and questioned, because they want to make sure there is no atom of pride in whatever you're doing. So in order for everybody to be balanced, for you to have a good family balance, very good family dynamics, you have to make sure that he is also getting his own money while you're getting yours. If you want to do joint account, that's up to you. But I just want to say this and throw it out there, is also for foreign medical graduates. If they want to come over to the US, this is something they can be doing while waiting for the big job, which is their USMLE. I know most of them, their road, they want to just get into that residency program, and they will be happy. They will be so happy that they are now among those working in the U.S. Medical workforce. So it's all good, but if you give them this, it can be what you can use to kind of wait before they get into the role. All right. So thank you, everyone. I want to say a very big thank you to our guests. But there's a tradition with Decency NCLEX Academy podcast. Every time we come here and we have a guest, we always say thank you in different dialects, in different languages to our guests. That's a way to make our guests learn from us. It's not just you people, we learning from you. We want you to learn from us. So everyone on the comment section, you know where you came from, you know your location. Type thank you and type the country or the location where that is coming from. I want to see many countries. I want to see many people. Yes, Rams again, Madase, Ghana. Yes, thank you so much. So you see the way Rams did it, that's the same. I want everybody to do it that way. Dalurine from Igbo. Yes, thank you so much. And then Ese Adupe, Yoruba, Nigeria. Yes. Germany, Danke from Germany. Yes, Chinyere, thank you so much. Mungode, Hausa, but resides in UK. Thank you so much. Ndewo is Igbo. Igbo has so many ways of saying thank you. Okay. You see, Shukran, United Arab Emirates. Yes, you see, we are learning languages today. Yes, I have somebody from South Africa. I want to get that South Africa one. What did that South Africa say? Oh, no. He's running away. So many comments are coming at the same time. You say, Siyabonga from South Africa. Yay. See, I'm learning languages. Every Friday, I learn how to say thank you in different languages. So let's see. Keep going, guys. Keep bringing it. I want to see more. Ndewo from Arochukwu in Nigeria. Thank you so much. Deme should be Nigerian language. Thank you so much. Esheonu Yoruba. Thank you. Someone said I'm interested, but I don't have the amount now. What can I do? We just hope that you get it, or you can, just find a way. This is something you can invest in. It's an investment. So somebody is saying, Lami is saying, Modupe Gidi Gidi. That's thanks a lot. Okay, we have someone they will. Agba Egala from Nigeria, thank you. Mama from Igbo. There's Abia State. So many people are saying thank you in different languages. I can't even. Oh, yes, I have Zimbabwe. Zimbabwe say Primrose from Harare, Zimbabwe. Thank you so much for bringing the Zimbabwe side. See, Somto is taking notes. Okay, Mungo de Sosei from Hausa, Kaduna State, Nigeria. Thank you. Yeah. So let's get it. What's another one? Is there any other country? What of Gambia? My Gambian people, where are you? What's going on? I haven't seen you today. Gambia, Kenya, where is everyone? Please, can you guys come and represent in saying thank you? I want to see how you guys say thank you in Gambia. Zambia in the house. Okay. Tell me how they say thank you in Zambia. Songo Ese Uyo in Akwa Ibom. Thank you. Messi, Cameroon. Yes, we found Cameroon. So we have so many people from different places today. Thank you all for representing your country. Thank you. Zambia said is Zikomo. Zikomo is thank you in Zambia. Thank you, thank you, thank you. So at this point, we want to bring the program to a close. We want to say a very big thank you to all the people that have joined us today. We had over 100 people on this call. And then we have our very, 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 very delightful guests, Somto and Mary Ann Opara. Thank you for making time to be here. And Yemi, thank you so much, and God bless you for the discounts. We can't appreciate you enough. Thank you for always coming here with a bag of goodies. Thank you, and God bless you. Have a fruitful one, guys. Have a productive weekend ahead, and we hope to see you next weekend. All right, and then I think next weekend, yes, we're gonna be here. Next weekend, I'm guessing, but if next weekend is going to be cancelled, I will tell you the reason in all our platforms. Please kindly go to our YouTube channel at the end of this program. At least give me 2 hours. This program will be posted on YouTube and you can all watch it there. All right. Thank you and God bless you. Have a good one, guys. Bye, everyone.
Bye. Thank you.
Bye.